Okay, so you're in the hospital, and on top of whatever else is going on, you've got diabetes to manage. Your whole routine is thrown off, the food's different. It's a lot, right? Well, in this explainer, we're going to cut through the confusion. We're translating the official medical standards into a practical guide for you, so you know exactly what good care looks like and what questions to ask.
I mean, that's the big question, isn't it? Beyond why you were admitted in the first place, how is your diabetes actually being handled? Just knowing what to expect, knowing what good looks like, is the first step to feeling in control of your own healthcare.
And let's be clear, this isn't just about comfort. This is a big deal. The research is crystal clear. When blood sugar is all over the place in the hospital, it can lead to more complications and, you guessed it, longer stays. So getting diabetes care right isn't just a nice to have. It's absolutely fundamental to getting you better and getting you home safely.
So let's walk through this whole process together. We're going to follow the path of a typical hospital stay from the moment you check in to the day you go home, and point out the key moments where you can be an active partner in your own care.
Every safe journey starts with a solid plan, and the hospital is no different. Think of your admission as a kind of pre-flight check. This is where the team needs to get all the critical details about you and your diabetes.
Now, this isn't just a random checklist. This is literally the blueprint for your personal care plan. Your team has to know, are we dealing with type 1 or type 2? What's your A1C been looking like? How comfortable are you managing your diabetes on your own? The answers to these questions shape everything that comes next.
And here's a pro tip for you. Many hospitals have dedicated diabetes specialist teams, and the data shows that when they get involved, patients just do better, fewer complications, shorter stays. So don't be afraid to ask your nurse or doctor, hey, is there a diabetes specialist who could take a look at my case? It's a great question to ask.
Okay, so you're settled in. The next big thing is keeping your blood sugar in a safe zone. But, and this is something that really surprises a lot of people, the blood sugar targets in the hospital are often very different from the goals you have at home.
As you can see here, for most patients, especially those who are critically ill in the ICU, the target range is actually 140 to 180. For others, it might be a bit lower, maybe 100 to 180. And I know what you might be thinking. Wait, that seems kind of high. It's the perfect question, right? If tighter control is the goal at home, why ease up in the hospital? Well, it all comes down to one single incredibly important word: safety.
You see, a huge study called Nice Sugar completely changed the game. It found that trying to push blood sugars down into that super tight range, like 80 to 110, in very sick patients actually backfired. It led to way more cases of dangerously low blood sugar, hypoglycemia, which in a hospital setting can be life-threatening. So the number one priority is to keep you safely away from the highs, but especially away from the lows.
So if those are the targets, how does the team actually help you hit them? Well, for most people with diabetes in the hospital, the answer is insulin. But, and this is a big but, how that insulin is given makes all the difference in the world.
The best practice, what we call the gold standard, is a proactive plan called basal-bolus. Now, it sounds technical, but the idea is simple. It tries to copy what a healthy pancreas does. You get a steady, long-acting basal insulin in the background, and then you get shots of rapid-acting bolus insulin to cover your meals. The key word here is proactive. It's designed to stop high blood sugar before it even starts.
Now let's contrast that with the old school approach, which is now strongly discouraged, using only a sliding scale. This method is completely reactive. It basically waits for your blood sugar to get high and then tries to fix it with a dose of insulin. It's like constantly playing catch-up, which is why it's just not as effective or as safe.
All right, you've navigated your stay, you're on the mend, and it's almost time to head home. Believe it or not, this last step is one of the most critical parts of your entire stay. A really solid discharge plan is your key to a safe recovery and helps keep you from having to come right back.
So what does a good plan look like? It's got 4 essential pieces. 1, medication reconciliation. Your team has to compare your home meds with your new ones to catch any mistakes. 2, a follow-up appointment should be on the books before you walk out the door. 3, a quick review of survival skills. Making sure you're clear on how to take your meds and what to do if you go high or low. And 4, making sure you have all your supplies and prescriptions ready to go.
This is your moment. You can be your own best advocate. Don't feel like you're being rushed out the door. A simple, really powerful question like this one: can we just quickly review my discharge plan together to make sure I understand everything, make sure everyone's on the same page, and helps you leave feeling confident and safe?
Because ultimately, that's the whole point. Good hospital care isn't something that just happens to you. It's a partnership.
And by knowing what to expect and feeling empowered to ask these kinds of questions, you're no longer just a patient. You become an active, vital member of your own healthcare team. And that's a powerful place to be.